So this is a story of a young girl from Iraq who came to us with a problem of her left hip, which she's been suffering for the last 8 to 10 years. Now, this girl, she was when she came to us, she was around 40, and she'd been having hip replacement surgeries for the past 8 years. She's had two surgeries which had failed. She had a typical problem called developmental dysplasia of the hip. So, in that, what happened was, if we consider this as the normal hip, so there is a socket and there is a ball. So in that case, in her case, the ball was not inside the socket, it was outside, and hence the shape of the socket was also not at the right position. It was not the right shape. There was a lot of bone loss. So because of that, she had developed arthritis, and she had come to a point that she was having difficulty in walking. So she had a hip replacement done elsewhere around 8 years ago. Now, she was doing okay for the first year or so, but when for 1 year of the surgery, she developed complications. The implant got loose and her hip replacement failed. Now, when this implant got loose, it damaged a lot of normal bone as well. So the next time she went in for a revision surgery, they had to use a special cage inside so that there could be a cage which could provide stability in the base of this socket, and on top of it, a cup was placed. Unfortunately, this also did not last long, and it could not provide adequate support. Within 1.5 years of the second surgery, she again developed loosening of the implant, and so much so that the implant actually was protruding inside the pelvis. So from here, the implant that was placed, it went all the way inside, damaging all of the bone from here. So when she came to us, she had a failed hip prosthesis with the protrusion of the implant into the acetabulum going into the pelvic cavity. So what we did was, we could not use any of our routine implants for her, and we had to think out of the box. And what we did was, we got her CT scan done, and we made a model of her pelvis, a 3D printed model of her pelvis, and this is how it turned out. So all along here, from here to here, is where the normal bone should have been of the acetabulum, and it is not there. So this is a model of a 3D printed model of her own hip, about the exact same size, exact same shape, and showing us where the bone is and where the bone is not there. So this is from here to here is where she had lost all of her bone, and the implant had gone all the way inside because of that. So we had to actually prepare a model of her bone, and accordingly a special implant was curated for her, which was custom made for her, and which could cover all the bone defect, and it could provide stability, on top of which we could place a normal cup to make a hip replacement. Now, this is the model of that implant that we had to use. Again, this was customized 3D printed one. So this special implant, as you can see, is we just have to place it over here, and it fixes itself to the available best bone. And according to the best shape of the bone and size of the bone, we can actually put in screws through all of these holes and customize to go into the best quality bone available. So this gives you the nicest kind of fit, and with a good scaffold, and this gives us a very good result. With this inside, she was made to walk next day after the surgery. She could put full weight on this leg, and she is making good recovery. And within 1 month of her surgery, she has started walking without the use of any supports like a walker or a stick even. So hopefully in the time to come, she should make a good complete recovery, and this implant should last a very long time. Thank you so much.